Most men choose their underwear the same way they choose their socks, based on comfort, based on what's familiar, based on what feels right in the moment. Very few stop to think about temperature. I'm Dr. Emily Carter. I've spent over 15 years as a urologist, and one of the most overlooked factors I see in men's health isn't diet, isn't exercise, and it isn't even stress. It's heat. Specifically, the heat that builds up in the scrotal area throughout the day. And most men have no idea it's happening. You wake up, you get dressed, you put on the same type of underwear you've worn for decades. Tight, supportive, maybe synthetic. It feels normal, it feels fine. But from the moment that fabric touches your skin, something begins. Your body is trying to regulate temperature in a very specific area. An area that was designed to stay cooler than the rest of you. And when that regulation fails, even by 2 or 3 degrees, the effects start accumulating. Not overnight, not in a week, but over months, over years. This is one of those changes that men don't connect to anything else. They notice other things. Lower energy, reduced drive, morning differences, but they rarely think about what they're wearing under their clothes. And that's where the problem hides. Because your scrotal temperature isn't something you can feel changing. It doesn't send a signal. It doesn't cause pain. It just rises, slowly, consistently. And when it does, your body begins to adapt in ways that most men don't realize until much later. Let me explain what I mean. Your testicles hang outside your body for one very specific reason: temperature control. The optimal temperature for sperm production and testosterone synthesis is about 2 to 4 degrees Celsius lower than your core body temperature. That's roughly 34 to 35 degrees Celsius. Your core sits around 37. That small difference matters more than most people realize. When testicles are exposed to higher temperatures for extended periods, the cells responsible for producing sperm, called spermatogenic cells, begin to slow down. They become less efficient, they produce fewer healthy sperm, and in some cases they stop producing altogether. But it's not just sperm. Leydig cells, the cells that produce testosterone, are also temperature sensitive. They function best in that same cool environment. When the temperature rises, their output can decrease. Now most men think, well, I'm not trying to have children anymore. Why does this matter? It matters because testosterone production doesn't stop mattering at 50, or 60, or 70. Testosterone regulates energy, mood, muscle mass, bone density, libido, recovery, even cognitive function. And when the environment where testosterone is produced becomes chronically warmer than it should be, the body compensates. It adapts. It slows production. This isn't something that shows up on a test right away. It's gradual. It's cumulative. But over time, men start to notice. They feel heavier, slower, less interested. And they assume it's just age. It might not be. It might be heat. So where does this heat come from? The obvious answer is external temperature, summer months, hot showers, saunas. But those are temporary exposures. Your body can recover from those. The real issue is chronic low-level heat exposure that lasts all day, every day, and that's where underwear comes in. Think about the design of most men's underwear. Tight waistbands, snug leg openings, synthetic fabrics that don't breathe well, materials like polyester, nylon, spandex. These fabrics trap heat. They don't allow air circulation, and when you combine that with hours of sitting, especially in warm environments or during physical activity, the temperature in the scrotal area can rise significantly. Studies using infrared thermography have shown that men wearing tight-fitting synthetic underwear can experience scrotal temperatures that are 1.5 to 3 degrees Celsius higher than men wearing loose, breathable cotton. That might not sound like much, but remember, the testicles are designed to operate in a very narrow temperature range. A 2-degree increase is significant, and it's sustained, all day, every day. Your body tries to compensate. The cremaster muscle, which controls the position of the testicles, contracts or relaxes to move them closer to or further from the body to regulate heat. But when external factors, like tight underwear, override that mechanism, the muscle can't do its job effectively. The testicles stay too warm, for too long, and that's when the changes begin. There's another layer to this that most men don't consider: sitting. When you sit, especially for long periods, the testicles are compressed between your thighs. That compression reduces airflow even further. It traps heat. And it creates a kind of thermal pocket. If you're sitting in an office chair for 8 hours, in a car for your commute, on the couch in the evening, that's 10, 12, sometimes 14 hours a day where the scrotal area is under thermal stress. Now combine that with underwear that doesn't breathe. The effect multiplies. And here's the part that concerns me as a urologist. Most men in their 50s, 60s and beyond are sitting more than they ever did in their 20s and 30s. They're less active. Their metabolic rate is slower. Their circulation isn't as efficient, so the body's natural ability to dissipate heat is already declining. And then they add synthetic, tight-fitting underwear on top of that. It's a compounding problem. Let me be clear about something. This isn't about blaming underwear for every hormonal issue a man experiences after 50. That would be overly simplistic. But it is about recognizing that small, sustained environmental changes can have measurable effects on biological function. And scrotal temperature is one of those variables that's easy to overlook because it doesn't cause immediate discomfort. You don't feel your testosterone dropping. You don't feel your Leydig cells working harder to compensate. You don't feel the oxidative stress building up in the testicular tissue. But it's happening. And over months and years, those microscopic changes add up. This is where men often tell me, "But I've been wearing the same type of underwear my whole life. Why would it suddenly matter now?" The answer is that it's not sudden, it's been accumulating, and the body's ability to compensate has been decreasing. When you're 25, your circulation is strong, your metabolism is high, your hormone production is robust, your body can handle thermal stress and recover quickly. When you're 55, all of those systems are operating at a lower baseline. They're still functional, but they're less resilient. So, the same environmental stressor that had minimal impact at 25 can have a much larger impact at 55. That's not aging in the traditional sense. That's accumulated stress meeting decreased resilience. There's also a vascular component to this that I want to mention. The scrotum is rich in blood vessels. It has a specialized network called the pampiniform plexus, which acts as a heat exchanger. Cool venous blood returning from the testicles flows alongside warm arterial blood going into them, which helps regulate temperature. But when external heat is trapped by clothing, that system becomes less effective. The blood vessels dilate in an attempt to release heat, but if there's no airflow, the heat has nowhere to go. This chronic vasodilation can, over time, contribute to a condition called varicocele, where the veins in the scrotum become enlarged and engorged. Varicoceles are associated with lower testosterone levels and impaired sperm quality. Now, I'm not saying that tight underwear directly causes varicoceles, but chronic thermal stress can exacerbate an underlying tendency. And that's the point. These aren't isolated factors. They interact. They compound. Most men don't think about their underwear as part of their health routine. They think about diet, exercise, sleep, maybe supplements. But the things we wear, especially in areas that are thermally sensitive, can influence biological function in ways that are easy to miss. And because the effects are slow and gradual, they're often attributed to something else. I'm just getting older. It's probably my diet. I need to exercise more. Those might all be true, but they might not be the whole picture. What if part of the picture is simply that your body is operating in an environment that's 2 degrees warmer than it should be, 12 hours a day, every day? That's not aging. That's environmental stress. Here's something else I've observed in my practice. Men who switch from tight synthetic underwear to looser, breathable options often report subtle changes after a few weeks. They don't always connect it to the underwear. They just say, "I feel a little better," or "I have more energy in the mornings." Some report improved sleep. Others notice a slight return of morning firmness that had been absent for months. These aren't dramatic transformations, they're subtle shifts. But subtle shifts, sustained over time, can lead to noticeable differences. And the interesting part is that these changes often happen without any other interventions. No new supplements, no major lifestyle changes, just a reduction in chronic thermal stress. That tells me something important. It tells me that the body wants to regulate itself properly. It's designed to. But when we create environments that interfere with those natural processes, the body struggles. And when we remove those interferences, even partially, the body often responds. Now, I'm not suggesting that underwear choice is the key to reversing all age-related hormonal decline. That would be misleading. But I am suggesting that it's one variable among many, and it's one that most men never consider. They think about what they eat, what they drink, how much they move, but they don't think about what's creating a low-level thermal stress that their body has to constantly work against. And the reason this matters more after 50 is because every system in the body has less reserve capacity. Your thermoregulation isn't as efficient, your circulation isn't as robust, your hormone production isn't as resilient, so things that used to be minor irritations become more significant stressors. And when those stressors are chronic, sustained, and unrecognized, they contribute to a slow, quiet decline that most men just accept as normal. Let me describe what happens on a cellular level when scrotal temperature rises. Inside the seminiferous tubules, where sperm are produced, there are tight junctions between cells that create what's called the blood-testis barrier. This barrier protects developing sperm from the immune system and maintains a very specific microenvironment. When temperature rises, those tight junctions can become disrupted, the barrier weakens, and developing sperm cells are exposed to oxidative stress. That oxidative stress damages DNA, it impairs mitochondrial function, it reduces sperm motility and viability. Even if a man isn't concerned about fertility, this process matters because the same oxidative stress affects Leydig cells. Leydig cells produce testosterone in response to luteinizing hormone from the pituitary gland, but they're sensitive to their environment. When oxidative stress increases, Leydig cells become less responsive to hormonal signals. They produce less testosterone per unit of stimulation. Over time, this can contribute to a gradual decline in baseline testosterone levels. Again, this isn't something a man would feel immediately. But over years, it adds up. And when multiple small stressors are present, tight underwear, prolonged sitting, poor circulation, the effects compound. There's also an immune component. Chronic heat exposure can trigger low-grade inflammation in the testicular tissue. This inflammation, even if it's mild, creates a chronic state of stress that the body has to manage. The immune system becomes slightly more active in that area. Inflammatory cytokines are released, and those cytokines can interfere with normal hormonal signaling. This is one of the reasons why men with chronic scrotal discomfort or heat sensitivity sometimes experience changes in libido and energy that seem disproportionate to the severity of their symptoms. It's not just about the testicles, it's about systemic inflammation and hormonal disruption. And the source of that disruption is often environmental. Most men don't realize how much their daily habits affect this. They sit in the same chair at the same desk, wearing the same type of clothes for years, and nothing feels wrong. But the body is adapting, it's compensating, it's working harder to maintain balance, until one day it can't compensate anymore, and that's when men start noticing changes. Lower energy, reduced drive, slower recovery, morning differences, and they assume it's inevitable. But what if it's not? What if it's just accumulated stress meeting reduced capacity? I want to be very clear about something. I'm not telling you to throw away your underwear or blame all your symptoms on what you're wearing. That would be irresponsible. But I'm asking you to consider this as one factor among many. Because the reality is, most men never think about thermal stress as a health variable. They think about calories, exercise, sleep, stress. But they don't think about the microenvironment their body is operating in every single day, and that microenvironment includes temperature. If you're wearing tight synthetic underwear for 12 to 14 hours a day, and you're sitting for most of that time, your scrotal temperature is likely higher than optimal. How much higher? That depends on the fabric, the fit, the environment, and your activity level. But even a small sustained increase can have effects over time. Here's what concerns me most. This is one of those issues where awareness comes late. Men don't connect the dots until they're already experiencing symptoms, and by that point, the changes have been building for years. The earlier you recognize it, the more options you have. But most men don't recognize it at all. They just assume everything is fine because nothing hurts. And that's the problem with slow, silent changes. They don't announce themselves, they just happen. Your body is always trying to maintain balance. It's always working to keep systems functioning optimally. But when you create environments that make that harder, whether it's through diet, stress, sleep, or even clothing, the body has to use more resources to compensate. And over time, those resources run low. That's when you start feeling the effects, not because you're broken, but because you've been working against your body's natural processes for so long that it's exhausted. And the frustrating part is that many of these stresses are so normalized, so accepted, that men don't even think to question them. This is just how I've always done things. But that doesn't mean it's optimal. It just means it's familiar. Temperature regulation is one of those biological functions that operates silently in the background. You don't think about it. You don't monitor it. But it's happening constantly, and when something interferes with it, even subtly, the effects ripple outward. Lower testosterone, reduced sperm quality, impaired circulation, increased oxidative stress. None of these things happen in isolation. They're all connected. And they all trace back, at least partially, to the environment your body is operating in. So where does this leave you? It leaves you with awareness. Awareness that the choices you make every day, even choices as simple as what you wear, can influence your long-term hormonal health. It leaves you with the understanding that thermal stress is real, cumulative, and often overlooked. And it leaves you with the knowledge that your body is still capable of regulating itself, but it needs the right conditions to do so. Most men won't think about this. They'll keep doing what they've always done, and over time they'll notice changes, and they'll accept them as inevitable. But now you know, it's not always inevitable. Sometimes it's just accumulated stress meeting decreased resilience, and sometimes the solution is simpler than you think. Not a pill, not a procedure, just removing one more source of interference.